All right, so good morning, everyone. We're going to talk to you about setting up your PCA pump to your patient's order. A couple things you're going to need: the PCA pump itself, with the key that can be obtained from the Pyxis if you override and type PCA key. The next things you're going to need are the IV tubing that goes with the PCA. So the PCA tubing itself comes with a couple different pieces. The anti-reflux valve tubing, which has the PCA setup with the port that goes to the IV fluids, and the connection piece that goes into the PCA syringe. The next thing you need, obviously, is the patient medication, which looks like this. It comes out of the Pyxis in the glass vial. Remember, it is glass, it is breakable. So, with the yellow cap on the tubing itself. Okay? So, we have our orders in Epic that we're going to pump into or place into the pump. So, first order here we're going to keep an eye on is our fluids just for our PCA. So, prescriber can order this, prescribe whatever thing they want the TKO rate to be at, and then you can set up your medical ICU pump to that order, just like you would set up the medical ICU pump to that order. The next thing we're going to show you is the PCA orders. So under your PRN, you have a couple different order sets here for the dilaudid PCA. So you have here your first order for bolus dosing in the event you need to give a bolus dose with the PCA. Narcan, obviously, for safety. The PCA order itself and what the PCA order should look like. If you're doing a PCA in a continuous setting, more to come on that. And then additionally, if you need to give a loading dose of the medication, the loading dose order should be in your schedule of medications under PCA loading dose. This is usually a one-time order. And then if there's any extra breakthrough stuff, that would be under your PRN medications. Okay, so let's set up the pump. First thing we're gonna do is open the door with the key. Next thing we're gonna do, we're gonna take our PCA tubing, we're going to screw in the connector to the glass vial, and then we're going to take the tubing, attach that to the plastic part, and then before we place this into the pump, we need to ensure that the clamps on both sides are clamped. This is to ensure that medication doesn't accidentally get primed through that you don't see and have to go about the fun stuff of wasting. So once you have all that hooked up, we're going to load it into the system. Things to pay attention to on the system. You have the plastic plunge port, a couple different parts here. First, you need to squeeze the two cradles to release and move that about the machine. Make sure the cradles are all the way up. Second part is you need to ensure that the plastic bottom part of the syringe, that part right there, gets placed into the bottom portion of the machine. And the barcode on the glass vial is read by the barcode on the machine. Once the barcode actually gets read by the machine will actually turn on by itself. So I will have Christine demonstrate here. Place the vial bottom part first and then into the top. The machine will turn on once the barcode gets read. And then for ease of sake, move the two levers, push them in, and push the syringe all the way down. And then use the plastic part to seat it into the bottom portion of the machine. You should hear a click. If you do not hear a click, restart. The machine will ask you if this is a new patient. You hit yes. Then you select your dosing. So you have adult standard, adult high dose, or if you're working in the pediatric department, use the weight-based standard measurement. For our purposes here, we're going to do adult standard. Hydromorphone 1 milligram per mil is the syringe that we have in here. I will tell you this, the order in Epic does not match what we currently have in the education room, so we're just gonna follow it as if it's this and ignore that on the PCA. But in real life, you need to make sure your dose is correct with the syringe and what your machine says, in addition to what Epic says. Okay, so once we confirm that that is correct, we're gonna hit confirm, and then it's gonna ask us if it wants to auto program or manual program. You're gonna hit manual program, and then you're gonna confirm that you're manual programming. Do we need to set a loading dose? So, yes, on your order set here, remember how we said this was a scheduled medication. So we're gonna set a loading dose for 0.2 milligrams as a one-time dose bolus to give to the patient. So, on the machine, you're gonna hit yes, and then you're gonna enter 0.2 milligrams, and then hit enter. All right, now you set your loading dose. You have 3 different options here for your PCA, depending on what the physician orders, or advanced practice provider, whoever's ordering your PCA. PCA only is only for boluses that the patient can administer via the patient pump right here. PCA and continuous is for a continuous infusion and a PCA setting. So means that the patient gets both, or continuous if we're just gonna straight infuse this into the patient. For our purposes here, we're gonna do a PCA and continuous. All right, so we're gonna do our PCA dose from our order. So the way we're gonna see that on our continuous setting with our dilaudid medication, our PCA dose is 0.2 milligrams every 15 minutes. So set that to 0.2 milligrams, hit enter, and then it'll ask you your interval. In this case, the order says every 15 minutes, so hit 15, hit enter. All right, now our continuous. So again, our continuous is what the our basal rate. So our patient is gonna get 0.5 milligrams as a continuous dose. So 0.5 milligrams. And then there it is asking us to enter in a limit, which means the total amount of medication the patient can receive in a 4-hour span. In this case, the doctor has set a 4 milligram 4-hour lockout. So the patient can receive a total of 4 milligrams in 4 hours. So hit 4 and then hit enter. All right, so now we have a hydromorphone with the concentration on a PCA and continuous setting with a loading dose of 0.2 milligrams. If all that is correct, you hit confirm, and then it brings up your PCA lockout continuous rate and 4-hour limit. This is the double check that needs to be confirmed by 2 RNs when signing this off in Epic. Once you have your second RN friend confirm all that, you hit confirm on the pump, and then close and lock your door. Close your door, lock. Now, when you're initially setting this up, the machine will ask you, do you want to prime the tubing? You can hit yes if you're the one initially setting this up. You're gonna make sure that your patient end is disconnected from the patient. Hit continue. Once you confirm that, it's gonna ask you again, is it actually disconnected from the patient? You hit yes, and then you press and hold the prime key. And then you should see your medication priming through your tubing. Make sure your clamps here are unclamped so that you can see the medication priming through the tube. Once you see it primed, hit yes, and then you may reconnect to the patient. Once you've confirmed that you're actually connected to the patient, hit yes. Then on the bottom, you hit start. There you go, hit start. And your medication should begin infusing your loading dose. Once your loading dose has infused, the machine will ask you to start your continuous infusion, so you need to just hit start again. And your patient has your continuous medication infusing with the addition of additional bolus in 15 minutes.